Hello, my name is Bill Temes and I'm with NAIOMT faculty. One of the more difficult movements to regain with an individual who's had problems with their shoulder is the combined movement of bringing their hand behind their back, typically into extension, adduction, and medial rotation. We look at the shoulder girdle movement at many different levels. One of the areas that I think contributes significantly to this restriction, though, happens to be with the scapulothoracic mobility on the spine. The movement that seems to give restriction to this is the elevation of the scapula with retraction, which is typical of the lower and middle fibers of serratus anterior, which tend to get tight. In order to assist with this motion and restore this movement some, we're going to have the individual lie on their side with obviously the involved side up. We're going to elevate the scapula and retract the scapula as far as we can. We'll fix the lower border of the scapula on the lateral side. But the key element to this technique is going to be to have the patient place their forearm on the therapist's abdomen, and I'm going to first resist her and ask her to resist my pulling the scapula down from the elevated retracted position, prevent her from moving the scapula in lateral rotation, and I'm going to then ask her to push her forearm into my abdomen, thereby engaging serratus anterior. Keep going. Take up the relax now, at which point I take up the slack of elevation retraction. I again resist my pull down and pull forward of your scapula, push into my abdomen with your forearm, hold, 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 hold. Relax. I'm going to take up the slack. And I would do this until I wasn't taking up any more significant slack to the system, and then come back in and make sure that she has the movement pattern coming back in and having her assist with that, and then ask her to take her hand and place it behind her back and see if we've regained any significant motion in that position.